we are here for presenting data on the GeparSepto trial, which is a phase 3 open randomized trial on patients with invasive breast cancer who showed either triple negative behavior or HER2 positive behavior. And in total we randomized 1,200 patients, and they have been prospectively randomized according to their profile, being triple negative or HER2 positive, either to receive 12 cycles of Nab-Paclitaxel weekly, and then followed by EC arm, and in the other arm they were straightforward treated with Nab-Paclitaxel followed by the same anthracycline containing regimen. So those patients who have presenting with HER2 positive disease received a dual blockade of trastuzumab and pertuzumab, and the primary endpoint is pCR, and other secondary endpoints have been dedicated to overall survival, toxicity, and some other objects. So what we learned over the years is how to increase the pCR rate. As we know from Betty Cortazar's meta-analysis, that this is translating specifically in the HER2 positive and the triple negatives and a better outcome, which is disease-free survival, or if the data are mature enough, to overall survival. So interestingly, and that has been reported at a different meeting and has been published in the Lancet Oncology in 2016, that the use of Nab-Paclitaxel translate in almost 10% better pCR in the whole entire group, and this is actually driven by the triple negatives. So now we showed the data that this disease-free survival is pCR rate is translating in better disease-free survival for those individuals who are responding with a pCR. So we have a very stringent definition of pCR, which is not only in the breast, what the NSABP measure was, it is in the breast and it's in the axilla. So that the total number is a little bit lower than the numbers when you just look at the breast, but we have an increase of almost, as we publish this, of 10%. And then what we would like to know is this translating in event-free survival? And this is dramatically, it's a dramatic difference. And again, what we see in a subset of patients, this is just an observation from this trial, that those who are presenting with a low Ki-67, less than 20%, even if they're not responding in a pCR, that these patients have a better disease-free survival. So this is it's an hypothesis generation observation, so we want to see if we can get any information on that. And again, which is very important, the estrogen receptor status, and this is linked to an ongoing endocrine treatment, is also benefiting in this group. So the bottom line is that the observation of this trial is in line with all the data that has been presented here at that meeting, that in the poor prognosis group, triple negatives and the HER2 positive disease, when they receive a subsequent treatment, that the disease-free survival is really early on plateauing at a very high level of about 80 to 85%. So this is an interesting observation, that the drops are very early on, and then when you figure out those who are relapsing, that they have obviously linked to the pCR an outstanding perfect event-free survival.